Pleased to chat virtually with the president of the South Shore YMCA, Paul Gorman, to give us a little update on what's happening at the Y and in the community. Paul, great to see you. Thanks for spending some time with us.
Thanks, Joe. Thanks for having me.
I guess the biggest news, if you will, is that the Y is closed to the public but open for the community, serving the homeless population, right?
Yeah, that's one of the things we're doing. Obviously, we've been closed since the middle of March, frozen everyone's memberships, and we've had a furlough about 1,100 people. So that's significant. We have about 50 folks still working for us, and they're doing several different things. As you mentioned, we are working with Father Bills in the city to provide homeless shelter at our Quincy Y in our field house. Usually those folks are there just at the homeless shelter in the evenings. They check in at night and leave in the morning. But with everything going on, they're in the building pretty much 24/7. And our building is large enough that we can spread those folks out and have access to our facilities. We've set up some nice seating for eating, TV. They have access to our showers and locker rooms. So that's worked out well. As nothing against Father Bills, but as we were registering the folks coming in, one woman, as she came in, looked around and said, "Wow, this is an upgrade." It's nice to be in a nice big building. We're also have 4 sites for emergency childcare for essential care workers out there. We are serving almost 80 kids a day. That's the maximum we can have with 4 sites, and that's both in Quincy and North Quincy in the office park up at our North Quincy site, and down in Hanover, Mass, at our early learning site on 53. So those are essential care workers, doctors, nurses, first responders, any supermarket workers, that's an essential care worker. And then what's really ramped up is everything to do in Germantown regarding our food pantry. We have a mobile food pantry going out to folks who can't make it to our food pantry. We've been serving meals to some of the senior towers, not just in Germantown, but over Quincy Point, Pagano Towers, and a number of others as well. And our food pantry, which usually hands out about 3,000 to 5,000 pounds of food a week, this week will be 20,000 pounds of food that will be handing out to folks. So it's significantly increased. We've been out, we get most of our food for the Greater Boston Food Bank, but also from some of the supermarkets, Stop and Shop, Shaw's, Trader Joe's, among others out there. And then whatever things that we don't have enough of, we go out and purchase as well. So we've been doing a lot of fundraising for that. The city's helped a little bit on that, as well as the homeless shelter, working closely with Mayor Koch on this as well. We've also done, if you can think about that, although it's not the basics, it's really, especially for our folks that are working, because we're helping staff the homeless shelter as well, besides the child care workers and food pantry. These are frontline staff at a higher risk interacting with folks out there. And they're doing a great job. We've been recognized by one of our big donors, Herb Emelson, yesterday, gave away some gifts and treated them to a very, very nice brunch for our frontline workers, just in recognition and honor of their work. Our fundraising efforts have really ramped up on the foundation side and business side. Members, even though we've frozen members, we've called every member to see if they would donate their membership for this month and probably next month as well, to support these efforts. A neat story yesterday, it didn't start out so neat. Our van, our big cargo van, died for Germantown, which we have to go in all the time to Boston, the Greater Boston Food Bank, and then go around to the supermarkets and food delivery. It was 2006 van, and so one of our key development folks, Kathy Quigley, reached out to Dan Quirk at Quirk Cars to see if he could help us out. I spoke to Dan at 4 o'clock yesterday. He asked me if I could meet him at 4:30 to look at vans. By 4:40, we had a new van.
Wow.
So a real thank you and shout out to Dan for doing that. I'll pick it up here this morning. But no hesitation. He wanted to make sure we had the best one out there that met all of our needs. And so, a real community leader, and want to thank him for that. As well as so many of our other donors that have stepped up during this time. We as a Y, like most businesses, it's about having folks and members with the childcare, emergency childcare. The state gives us a certain amount a month for each classroom that's opened. So those essential workers don't have to pay, but it only covers half the costs. Right now, our childcare is closed to the end of June, and we just made the calculation. We're probably going to have a net loss just from the emergency childcare of about $180,000. Even though we're getting the summer, it only covers half the costs.
Yeah,
we have to have about 16 folks working with our 4 sites, because we're open about 12 hours a day, and the multitude of folks that have to work there. So right now, unfortunately, we're losing about $200,000 to $250,000 a week. A week. We have debt service and lease payments, and our 50 staff that we're paying with relatively very little income coming in except for fundraising, and the state is still paying for some of the state voucher folks, even though they're not here. They want to make sure that we hold those slots open for when we open, so they're still paying that. So we're really crossing our fingers, more so that we can hold camp this summer. Camp is huge for us. We have 1,400 kids a day in camp and day in resident camps, and I know at this point parents are ready to get rid of their kids into something,
and vice versa, probably too.
Right. So we're hoping. The CDC is coming out with some guidelines here this week. We've already had a peek at them. They're a little general. I'm not quite sure what that means. So it looks like it'll be restrictive, and we probably won't have the same percentage, which will impact us financially. And then, of course, when we're ready to open, we have the opposite of social distancing as the Y. We bring people together. As a member, you're in all the time. You know how busy our Ys are, and how we bring people together. And we'll be working on strategies of how to keep folks safe and healthy in our Ys. And obviously it'll be a lot less that we'll be able to use it. Who's going to come to a group exercise room when you have 30 people in a room to exercise? So we'll be working on that. We do have some online classes that are out there on Y360 and some others out there, so folks can access that for free to get their workouts at home. But the whole purpose of group exercise is not just the exercise, it's the socialization. In our calls out there to folks, for most of the people, they thank us for calling them because we're checking in on them as well. But for the seniors, we're on the phone for a lot longer. And isolation is a real issue for a lot of seniors. So, and we have a big senior population of our members in the Y. It's their community center, and they want to come back, and we want them to come back, and we want to make sure it's safe and for those folks. And we have a big medical wellness programs for people who've gone through cancer and pre-diabetes and any orthopedic issues, Parkinson's, MS, and they're at a higher risk. But again, we don't want them to be isolated or feel isolated out there. So we check in with them, and but we need to create some the environment that they can come back to in a community center. We're a social species, and the Y really represents that with 18,000 members in Quincy, and another 18,000 in Hanover, plus all the other program participants. We touch about 65,000 people each year. So we connect with a lot of folks on the South Shore. So it's going to be an interesting ride. We're here. We're going to continue to fundraise. We're going to survive this, but we're going to look different on the other side. And we're expecting it to be an 18-month event.
Really?
All the short-term, very restrictive things that we have to deal with here in the short term, and a slow releasing of that over a period of time until a vaccine and that herd immunization kicks in. And
right.
Hopefully, folks understand that we recognize that we're planning for a long ramp up, and we can weather the storm. It's going to be really tough. We're going to go through all of our reserves, that our endowment and reserves, and borrowing. We're borrowing some extra money to make it through there. So we can be an important part of the community, and hopefully when everybody's ready to come back, they'll come back to support us as well.
Sure. What are some ways right now, Paul, that the community can help out?
Well, if they go to ssymca.org, there are donation buttons there just to donate. If they're members, they can donate their monthly membership fee for the month, for April, and then May. Most likely will be closed at least part, if not all of May.
Mm-hmm.
It looks like. So that will really help.
Okay.
And then once we're open, for those folks that are able to go back to work, if they're not working already, to help support us until we're back on a roll. And we're going to look out. We're looking at ways for folks who have been our members for a long time, that when we open are still unemployed, that we want to make sure that this financial assistance, so they can come back to BOI, so they can come back as a family. Just because they may have lost their job for a short term or a little longer term, we want to stand by those folks as well.
Okay. What are you hearing from some of your colleagues in some of the states that are starting to open up a little bit? Well,
that's interesting. I do have a call with all those folks. I have a weekly call with the 60 largest Ys in the country every Wednesday. So pretty much some of the initial folks, when we heard last week, is they're not going to open up right away. Okay. They're going to go with the science. There's nothing worse than, and everybody's very anxious to open up, but there would be nothing worse to open up too soon.
Yeah.
And someone gets infected and it goes around the Y, and then all of a sudden the Y becomes a pariah and no one will want to go there. So my colleagues are looking at it the same way as we are here. We're going to be very cautious. We're the state and Governor Baker has been very cautious to this point. We support that. And so there's no reason to just flick the switch and come back. We want to do it based on the science and methodically for the health and safety of everyone. So we're going to work with the city of Quincy, Mayor Koch, his health department, the state and federal government, whatever the guidelines are. And this is not something, we don't have to be ahead of the curve of opening. We want to be cautious and support our folks out there.
I know that you had some food trucks coming by the Wyatt as part of your community challenge. Is that still going on?
Yeah. So thanks for talking about that. So what we've done is we've reached out to our donors. If you can look at everything that we're doing there on an emergency basis, childcare, homeless, food pantry, as the basics. We're making sure we're doing all we can on the basics. And so what we've done is twofold: to reach out to get donations, to do something different for our guests in the homeless shelter, for our kids in childcare, and for the people in the food pantry. Just something different and something they look forward to every week. And what we're also doing is supporting those restaurants that are also hurting through the donation. So they donate to us. We talk to the restaurants that have supported us, especially with our Taste of the South Shore that we didn't have this year, one of our largest fundraisers. Yeah. And so we pay them, we get the donation, and we pay those restaurants to come out to do something different. The first one was Paul Wahlberg with his Wahlburgers truck, who came to serve his Wahlburger, all of his burgers, to our homeless folks, to our kids in the child care center as well, and also over to Father Bill's. We followed that up with Montilio's came in with their transported their oven that's on a big wagon that they come and cook all those pizzas fresh. And then they also provide pastries to all the kids in the child care as well as the folks in the homeless shelter. Tinker's son came this past week to hand out shepherd's pie. Wahlberg's also, we paid him to have meals from Almanova to be delivered to the senior towers. So we've been doing meals every Thursday, 300 meals. We've had our resident camp, which we have big commercial kitchens, cook meals up for the folks in the senior towers. Chef's Table, through a donor, has come out a couple of times to provide meals to the seniors in the towers. And then tomorrow, Jimmy Liang is coming out from Fuji's to deliver rice bowls with meat so it's just something a little bit different for all those folks going through a lot more than we're going through.
Right.
And if we can just step that up, we got Easter baskets for all the kids over in Germantown donated and to hand out to the kids. So again, trying to create some normalcy amongst this chaos right now. So, it's a real shout out to Mary Orn and Kathy Quigley and John Galuzzo from our development department to reach out, get those donations to coordinate all those.
Sure. Should restaurants reach out to you if they'd like to participate as well?
Yeah, I don't know how much longer, doing it for the month, we could do that fundraising for that.
Yeah.
This expense extends another month or two. We'll work if there are donors that want to help us to do that. We can help facilitate that, and we'll work and share that around some of the restaurants as well. But as the businesses that are doing well, the foundations that are doing well, and donors that are doing well have been very supportive this month. It goes on for another month or 2 months. They're spreading their wealth around, being very generous to many organizations like ours. I'm not quite sure how much we can continue on, but we're going to try. We're going to try.
Yeah. Would donations of food and personal protective equipment be helpful, Paul?
So the personal protective equipment would be for food. What becomes very hard. What we've asked is donations in dollars, because then all the folks at the food pantry, the 8 people that are working on there, know exactly what those folks need.
Sure. Yeah.
Because sometimes some things would come in donated, and it might work for a few people, but not for all. So what we try to do is we have everything from canned goods, fresh vegetables and fruit, the staples of milk and bread, and a lot of protein meat as far as beef and chicken and fish. So we really try to balance that out. So everyone gets a balanced, they usually go away with about 2 bags full of food out there. And this week is always the biggest because it's the end of the month. So a lot of folks that are on any food subsidies, they've usually gone through it by the end of the month. So we see a lot more here at the end of the month.
Yeah. Okay. I can't help but think that the Y really is getting back to its roots when you welcomed the homeless population into the center. Years and years ago, as you're familiar, the Y was a refuge for folks like that.
Yeah, it's gone through transition. The Y started as supporting young men from rural America and help them assimilate into the cities, help educate them, become good citizens, and that evolved into like transitional housing for folks to come through. And then with privatization in the late 80s and 90s, Y housing became, more permanent housing for a lot of folks. And you're right. And now it's back into that transitional phase for folks, and hopefully, for our guests that are in our emergency homeless shelter, that they feel that, we've been very supportive to them, and we're here for them
Yeah.
now and in the future.
Yeah. Ever think you'd be going through something like this in your personal career?
Well, absolutely not.
Yeah.
We've grown so much over the past 10. I've been here 11 years now,
Yeah.
and we've grown so much. We've more than doubled in size, and we're out of the 800 Ys in the country, we're in the top 40 in size. So, and we have a relatively small service area. Those otherwise in the top 60 are all in major metropolitan cities. So we go very deep here, and we're going to come out much smaller in the end. We're going to have to look at fees a lot differently because a lot of people won't be able to afford, the usual membership fees, or so it's we're really looking hard at that, and we're going to be thinner as far as staffing wise.
Sure.
And it's going to take a long time to ramp up back to where we were.
Yeah. Anything else you'd like to let the folks in Quincy know, Paul?
No, that we're here to help and support them, for folks that are in dire need right now. But also when we open up, we're here to help you get your physical and mental health back into shape, and to support you, to support our children. Early education is such an important part of what we do, and after school and camping. The youth and their future, we want to continue to be an important part of that and working with families.
Sure. Again, ssymca.org website.
Yes. Yep.
And
that would be great.
Sure. And are folks answering the phones if people call?
They are. If we're small, we have a smaller staff answering the phone. So if they leave a message, we're getting right back to them.
Okay. So. All right. Very good. Good to talk to you. Appreciate it. Hopefully we can do it in person soon.
Yeah. Thank you, Joe. Always enjoy these.
All right. If we can help here at QATV, please reach out. We're happy to do it.
All right. Thank you again, Joe.
You're welcome.
Talk to you soon.
Okay. Bye-bye.
Bye.